massive headache. Can you give me some ibuprofen?
Yeah, of course.
Oh, man. Cool. You open that?
Yeah.
Okay.
Go. Are you okay?
Um,
Your face isn't looking right.
oh. Oh.
Your headache?
Mm.
Let me just look it up. What about your arm? Can't. Just stay calm, okay? Just calm. Just hold on. The website says, the internet, Google, Dr. Google says, is it a stroke? Act fast. Face droops. Arm weakness. Speech difficulty. Time is critical. I need to call 911. We need to get you to the hospital. Knock knock. Hi. Nice to meet you guys. My name is Dr. Chow, and I'm going to be your provider today. Just want to check in with you and see how you're doing. Oh, just a little scared. That was a pretty scary event, but it's really great that you got here in a short amount of time. So firstly, I just wanted to introduce myself, of course, and I wanted to do a quick neuro assessment since we've already done a cardiac assessment on the patient. So we're just going to do that really quick. I'm just going to test your pupil reactivity. Okay, and then I want you to follow my pen. Okay, and then we're going to test your field of vision. So whenever I move my finger, I want you to take your left hand and point to which one is moving. Okay, and if they're both moving, just say both. Yeah, two. Okay. Okay. Good. Okay. So it seems like you've lost a little bit of your field of vision on your right side, which is a common symptom of a left-sided ischemic stroke. So I'm just going to have you squeeze my fingers so I can test your strength. Okay. Definitely a strength deficit in the right side. Thank you. And then I also want to test the strength in your feet. So are you able to push down? Okay, not much reaction on the right side. And then can you pull up? Okay, a little bit of toe wiggling on the right, but not much movement. So definitely strength deficit on the right side. Okay, so now that we've finished the neuro assessment, I just wanted to ask for a recap of the events, if you would, Laura.
Yeah, we were sitting at home, and he started complaining of a really bad headache. So I went to go get him some Tylenol, at which point he went to reach for his water bottle and couldn't grab it. And it was then that I noticed his face was drooping and that he was having trouble swallowing the Tylenol and having trouble talking to me at that point, and that was when I called 911.
And so you kind of recognized the symptoms, decided to do a little bit of research online and saw it fast, which is really good because strokes can damage a large portion of the brain if not treated in a timely manner. And so what is being shown on the diagnostic exams and through our assessments is that Jeffrey is experiencing a left-sided ischemic stroke, which is caused by a thrombus, which is a blood clot that has traveled to part of your brain, and in this case the left side of your brain, causing some deficits, some neurological deficits in your right side of the body.
So what are we doing now? What's next?
Well, what we're going to do now is get Jeffrey on some thrombolytic medications so that we can dissolve clots that may be developing that could affect him in the future, and including the clot that caused his stroke this time. Since he has a history of hyperlipidemia, having high cholesterol can create atherosclerotic plaques in his blood, which can also then lead to stroke and blood clots in other parts of his body. So there's going to have to be some change in his diet, lifestyle, including like some low cholesterol food, getting some more exercise, reducing smoking.
But I don't understand, where did the clots come from? His blood is liquid.
Right. But since he has extra cholesterol in his body, it gathers when cells come to essentially sequester the extra lipids in his blood. And so when that happens, plaques form and can narrow your arteries. And the narrowing of the arteries can cause hypertension, high blood pressure, and clots that form can break off and travel to other parts of your body, including your brain. And so since you are at a high risk for stroke because of your previous conditions, we want to make sure that we prevent this from happening again. And of course, we're going to get you physical therapy, occupational therapy, so that you can get back to living your life the way that you want to. But there are going to be some changes that you have to make in your lifestyle, including making sure that you are getting an adequate diet that is lower in fat, triglycerides, and then also making sure that you are getting enough physical activity to prevent any more stasis of your blood.
So, if you said therapy, does that mean that this is permanent?
Oftentimes, when the cells of your brain die, it is really hard for them to regenerate. Ischemic penumbra, which is the cells that are around the necrotic spots in the brain, can be saved if you act timely enough. So the fact that you recognized the symptoms and got into the hospital very quickly has most likely saved a lot of his tissue in his brain. But unfortunately, a lot of the neurological deficits that you see are most likely going to be sticking around. But with adequate physical therapy and occupational therapy, there are really great improvements that you can make that will increase your quality of life despite the stroke.
So what is this penumbra thing you're talking about? What is that again?
So a penumbra is, ischemic penumbra is going to be like a halo of affected tissue around the initial
Like where the clot is in the
Yes.
brain, so it's like whatever dies because it didn't have oxygen?
Yes.
Okay.
Yeah, so it's not going to immediately die off as long as you can get into the hospital in a timely manner so that we can prevent more tissue from dying by giving him thrombolytics like warfarin and blood thinners. And since his diagnostics came back and they are saying that there is a clot that needs to be dissolved, he's got to stay in the hospital for a few more days so we can monitor him and make sure everything's going smoothly. And Mr. Jeffrey, I just wanted to explain some of the symptoms and signs that you were experiencing when you were at your house. just so you kind of get the connection between what was happening and what an ischemic stroke is. So I know that your wife was saying that she witnessed first some weakness in your left arm. So a stroke can cause sensory loss and functional loss of a specific side of your body, which is why you felt that weakness in your arm, but also it can affect your legs as well. And it also causes a visual field deficit. So when she was coming back to you and you couldn't see her out of that eye, it was because of the stroke affecting your brain. Another sign and symptom of having a stroke is slurred speech and speech impairment, which is why it's been difficult for you to express your thoughts, right? So it seems that your the part of your brain that's affected is Broca's area, which means that you have expressive aphasia. That you understand what we are saying to you, but you have difficulty forming words and forming responses. And you did also have some problems with swallowing because it affects your cranial nerves 9 and 10, which control the ability to swallow. So we had to do an assessment on you and make sure that you can swallow before we just start letting you eat, because that's a big problem with stroke patients, is that they often have aspiration, which is fluid and food going into your lungs. So that's why we have to keep you at the hospital for a little bit longer, just kind of watch how you're progressing and make sure that you're getting enough fluids and dietary needs to heal it properly. Any questions? Okay. Date on the neuro and cardiovascular assessment that we did on Jeffrey, and it does imply that he has an ischemic stroke on the left side of his brain. It seemed like there was quite a lot of strength deficit on his right side, and he definitely has a diminished visual acuity on his right side as well. He definitely could not see my finger out of the field of vision, and oftentimes when I moved both fingers, he could only detect one moving. And so I think what you should be looking out for in the future is just making sure that he has stabilized blood pressure and cardiac rhythm. You also want to make sure that his body temperature is regulated and his blood glucose levels are also important to check, just because it can affect his body system-wide. And as you already know, a treatment for acute ischemic stroke includes IV thrombolytic medications, which is why we have them in the hospital and an IV running with that medication in it. In the future, what you did was perfect. Make sure you just remember the acronym FAST, and seek treatment immediately. So when he first got here, we immediately did a CT scan, some electrocardiography, chest x-ray, and blood work, along with some brain imaging studies so that we can really get a big picture of what's going on with the stroke, just so that we can understand the extent of the stroke. But we also were able to compare his previous medical history and what's going on right now, so we can rule out any issues or any previous medical conditions that could be causing these symptoms. And we have settled on the diagnosis of stroke. Do you have any questions about that?
No questions right now.
Okay.
Thank you.